Number 20. What is the process by which a healthcare provider identifies the pathogen and then selects the antibiotic to be prescribed? The answer is, the process by which a healthcare provider identifies the pathogen and then selects the antibiotic to be prescribed is C&S, which is an abbreviation for culture and sensitivity. Sample let to incubate to identify bacterial growth. Number 21. What are some diseases that are treated by the natural and semi-synthetic penicillins? The answer is, some diseases that are treated by the natural and semi-synthetic penicillins are UTIs, septicemia, meningitis, appendicitis, an intra-abdominal infection like appendicitis, gonorrhea, syphilis, respiratory infections such as bronchitis or pneumonia, throat infections like strep throat, and ear infections like otitis media. Number 22. When is penicillin used prophylactically? The answer is, penicillin is used prophylactically when a potential secondary bacterial infection that occurs is when a client has a viral infection. It is used for the prophylactic prevention method, and is often used before dental or oral procedure, and high-risk individuals with rheumatic fever or chronic ear infections. Number 23. What is the most serious side effect to penicillin and what should the PT be alert after administering penicillin to a patient? The answer is, the most serious side effect to penicillin and what should the CITEC be alert for after administering penicillin to a patient is allergic reactions, like an anaphylactic shock. Number 24. How soon after giving penicillin may an allergic response occur? The answer is, after giving penicillin an allergic response may occur as soon as 30 to 60 minutes. 25. What are the early symptoms of an allergic reaction? The answer is, the early symptoms of an allergic reaction are pruritus. Pruritus is a medical term that means itching. It refers to a feeling or sensation on your skin that you want to scratch. Itching and urticaria. Hives are a skin reaction that causes itchy welts. 26. What are the most important interventions when a client experiences respiratory arrest associated with anaphylaxis? The answer is, the most important intervention when a client experiences respiratory arrest associated with anaphylaxis is begin CPR to maintain their airway, and administer epinephrine or antihistamine. IMIM is an abbreviation for intramuscular. 27. What are the symptoms of bowel pseudomembranous colitis? The answer is, the symptoms of the bowel pseudomembranous colitis are diarrhea, abdominal cramping, rectal bleeding and fever. Next question. What are the symptoms of mouth candidiasis? The answer is, the symptoms are oral thrush causes white lesions on the tongue or inner cheeks. Next question. What are the symptoms of vaginal candidiasis? The answer is, the symptoms are yeast infection causes vaginal discharge and itching. Number 28. Interactions of oral contraceptives with estrogen to penicillin. The answer is, interactions of oral contraceptives with estrogen to penicillin decreases the effectiveness of contraceptive birth control. Number 29. What assessments are necessary to make prior to giving penicillin? The answer is, the assessments that are necessary to make prior to giving penicillin is obtain the patient's general health history, such as allergies, medical and surgical treatments, drug history, etc., and assess current symptoms of infection or risk for superinfection. Number 30. What is an ongoing assessment during therapy? The answer is, the ongoing assessment during therapy includes vital signs every 4 hours, C&S. C&S is an abbreviation for culture and sensitivity of infected site, and check for signs of allergy or infection.